222 774. Dr. Monique Ryan is the independent member for Kooyong, can join you now. Welcome back to the program.
Thanks, Warwick. Good to be with you.
Good idea, bad idea, costs too much. What do you think?
Well, the problem is that we actually can't answer those questions because we actually don't have the information that we need to be able to answer them. So I guess the first thing is, like, listening to Susie's experience, that's fantastic. And we do know that many people struggle to get to a GP, especially out of hours. People don't want to have to go to an emergency department at 6 or 7 in the evening for something which is not urgent, but they don't have any other options often. And so the idea of expanding out-of-hours care for Australians is a really attractive one, especially if it's free of charge. The issue is that the government has opened 87 of these urgent care clinics, usually in existing medical clinics in the last 18 months or so, at a cost of over $1 billion. And the cost to the government of patients being seen in those centres has been estimated as being close to $300, as opposed to the $40 or $50 that it costs the government when those same people are seen by a GP.
Oh, really? That's the difference. So $300 at an urgent care clinic compared to under $50 at a GP. Why such a gap?
Well, because apparently these urgent care clinics are paying the GPs who are working there a significantly more amount of money, but also these urgent care clinics are being run by corporate entities, not by small GP clinics. So it's a different model of care. Now, it might be a good model of care in some cases and for some people, but we don't really know whether or not the clinics are working as they're supposed to. We don't know if they're decreasing presentations to emergency departments. The small amount of data that we have suggests that they're not. We don't know that people are getting the quality of care that they need. We know that lots of these clinics are having difficulty staffing the out-of-hours services, and so they're taking GPs from existing clinics to do that. And we don't have any idea of the cost effectiveness of it. We've already spent $1 billion on this service, and the government's now saying that it's going to spend another $640+ million on it in the next 6 months or so. Basically what I'm saying is, could we please have someone independent do a cost effectiveness and quality of care analysis on this service?
What are your chances of getting any of those answers to those questions before the election? As you're in no doubt aware, there is one close.
Two chances, but Warwick, Buckley's and none. But I basically what I'm asking the government and the opposition as well is that they're talking a lot of money to go into healthcare, and both of them have promised $8 billion last week, and now the government's found another $640 million odd for these urgent care clinics. It's great that they're putting more investment into medical care, but what we want it to be is evidence-based, and we want to see evidence that's going to improve the patient experience and the experience for people who have to go to hospitals as well.
Peter Dutton says it's pork barrelling, is it?
I don't know, because we don't know on what basis the clinics are being placed in certain sites. Now, it does seem that there's possibly a slightly more that are going to seats held by the Labor Party or seats that they're hoping to win at the next election.
If that's the case, that is far worse than sports rorts, isn't it? Then the coalition was taken to task over funding sporting clubs in a pork barrelling way. Healthcare is far more important than that.
I think healthcare is really important, and I do feel strongly that we shouldn't be pork barrelling on it. But what I'm saying is I really would like the government to give us some information as to why they've decided to put the existing clinics where they are and on what basis they've made the decision to put these new ones where they'll be. We just need transparency around it, and we need to understand the basis for it.
And you say that the cost is something that you have major questions about. Do you think Australians will vote caring about the cost of healthcare or whether they can get to a clinic and if one is close to them?
Well, we all pay for the cost of healthcare ultimately, and I'm hearing every day from people that they're worried about going to hospital. They're terribly concerned about the cost when they have to see a specialist because the Medicare contribution to that is negligible. They're worried about their GPs and the continuity of their GP service and the quality of care that GPs can provide to them. People care about healthcare. It's a really important thing. And all people are asking me is, well, on what basis is this decision being made, with the urgent care clinics, but also with the extra investment into Medicare? It's not what the independent reviews have asked for in the last 12 to 18 months. People don't want Band-Aid solutions. They want to be able to have the confidence in Medicare that it will continue to provide the very best quality healthcare for all Australians.
So if $644 million doesn't go to more bulk billing urgent care clinics, where would you spend that money?
I would put it into clinics that support GPs in providing these sorts of services, because I think the continuity of care that you get from having your own family doctor is important.
So pay a GP to stay open longer?
Yeah, potentially. But I think that there are issues with our medical system overall. The fee-for-service model, where you get paid to see someone when they're sick, is not in the long term going to be as good for this country as a model of care where we pay doctors and allied health professionals, physios, OTs, dietitians, pharmacists in clinics to keep people well. And that's the change of focus that recent reviews have asked for from the government and the opposition. But what we're seeing instead is short-term band-aid solutions for a system that really needs systemic reform.
How are you feeling, I suppose, in the lead up then to the next election? Do you think you'll be back in Canberra anytime soon, or is it now all guns blazing until the election to decide whether you'll return at all?
Well, the political parties have been spending a lot of money, or theoretical money, potential money, in recent weeks. It really does feel like the PM's about to call the election. I'm not sure that we'll be back to Canberra before the next federal election.
Dr. Monique Ryan, it's been good to talk healthcare with you today, and also just get your view on that. Do you have a tip on the date yet?
I'll be picking April 12th if I had to put my...
Like everyone else, it feels fairly set. Thanks for your time. To Dr. Monique Ryan there, independent member for Kooyong.